Brandon Cooper with us. He's a pharmacist here in Arkansas. Brandon, how are you, sir?
Good. Thanks, Paul.
It's always great to talk to you. I first kind of got connected with you when you were willing to come on and talk about the pharmacy benefit managers, the PBMs, and what this is doing to local small pharmacists and pharmacies. Can you kind of just start over and tell us what the problem is with these?
Well, I refer to PBMs as the PBM mafia because really, in essence, they are. I mean, they control such a large portion of healthcare and operate in secrecy. It's like, I was with the Pharmacy Association for years, and we would fight this every legislative session, and it took at least 15 years to finally get people to understand what we were talking about because all this happens behind the scenes, and it really is something people don't realize goes on behind the scenes with the payment for their prescriptions. So what PBMs were originally designed to do were just to be a claims processor. So in other words, instead of an employer trying to pay for their employees' health benefits on the prescription side, they would contract with these PBMs who would contract with the pharmacies, and that way the industry or the insurance company wasn't cutting checks to each individual pharmacy. They would more or less go through this intermediary, which would then pay the pharmacies and then charge. But in a few years, I think the PBMs realize it's like, hey, we control a large chunk of this money here, so maybe we should start, kind of seeing where we can go with this. And then you started seeing things like the formulary management where they would, contract with certain drug manufacturers to get their particular drug on formulary, and then they would receive these kickbacks and rebates. Then they realized that since nobody knew what they were paying the pharmacy and what they were charging the employer or the government or whoever they contracted with, they were like, well, we could create this spread of money here. Pay them one thing and then turn around and bill for another. And we've just got these, really the opportunities were unlimited for them and how much money that they could make off the backs of, employers or employees, patients, the taxpayers. So you kind of see their role now as just this huge behemoth that's just, out there draining dollars away from our healthcare system.
So where do these big corporate pharmacies come in here, right? CVS, for example.
Well, what you found was a lot of consolidation, what we call vertical integration in the PBM world, in the insurance company world. Now you have these PBMs contracting with certain pharmacies, or actually owned by certain pharmacies. Then you have them also merging with insurance companies. So you have this whole entity here that controls money every which way. And so really now there are three big PBMs, which are CVS Caremark, Express Scripts, and then Optum Rx. And they control this huge chunk of the marketplace. And now you just keep seeing more and more. They'll gobble up. They try to align themselves with certain insurance companies and pharmacies. And really the big one player we've seen in Arkansas that actually led to the special session was CVS Caremark. Because, if you just think about it, someone that controls the money and how much they pay certain pharmacies, say independent pharmacies or even Walgreens or Kroger or Walmart, if they also own or affiliated with a pharmacy, then you can see where the conflict of interest might, kind of
absolutely
kind of sway there.
So if you're an independent pharmacist, and how is this hurting them? They're not making. Essentially, it comes down to they're not making enough money off of this drug that they're selling to a patient. Is that what's going on?
Well, I think what led to the special session is it just got too overwhelming, and whereas we were making a small profit margin on something, it just became to where we were losing money by actually dispensing a prescription.
Okay, so has that's where I also wanted to get to. So you had the special session because it was it was like a clarion call or whatever. People just, it was a groundswell from pharmacists like you. And the legislation gets passed. So has that helped in any way? Has it done what they said it was going to do?
It has helped, and because it actually holds them accountable now. If you think about it, anywhere down the line, pharmacists are licensed, you have doctors are licensed, even insurance companies are licensed by some governing body, and they have rules to follow. But the PBMs actually had no license at all. And I know you, Paul, as well as I, a lot of times we don't like government, interference in things, but in this realm, there was no referee for this playing field.
Yeah.
And so in Arkansas, it really started. We were the first in the nation to actually require them to be licensed. And so what we found out is that they didn't really like that much. So they fought it, every step of the way, and now it has just spread nationwide. And I'll talk a little bit more about that if you want me to, and how this groundswell actually started here in Arkansas is now has just we lit a match that has just gone nationwide.
Okay, so now other states are saying, listen, you're going to have to answer to some authority, some licensing authority, if you're going to be a PBM.
Right.
And operate in our state.
Right. And we had a set of rules that they had to follow. They can't pay us below cost. They can't steer to their own mail order or their own pharmacy and pay themselves more.
Mm-hmm. Now, did that come with a transparent? I can't remember. Did we get the contract was going to be available for the public to see, or the government?
Well, the insurance commission.
Okay.
Actually, their license, they go through the insurance commissioner, who has to look at the contract.
Okay.
And then there's this access issue. In other words, they have to have a certain amount of pharmacies in the state of Arkansas to where you or I or anyone across the state has access to a pharmacy. Because that's so many times we see these PBMs come in and try to shuffle to their own pharmacy or to their own mail order pharmacy. Well, that really creates a hassle if there are no pharmacies, around for someone's, like acute needs that needs something. And I know one thing I want to touch on is that this only deals with plans that the state has an interest in. So in other words, state-sponsored plans. So that would be your Arkansas Works, or it would be state employees, some kind of fully insured prescriptions. But with all the others, which are a large majority of claims, there's still no transparency. And so that's where we're looking to try to get some more traction nationwide.
Okay. So there's more to do, and this would be it. And that's what I have here. Let me see here. Arkansas Money and Politics, October 2019. Headline: Pharmacists Prescribe Access, Economic Impact in Arkansas. It's a piece written by Tristan Bennett. And it talks about the Arkansas Pharmacists Association and how you guys still have more to do. So how does that get done? Is that as simple as legislation, or are there going to be people saying you can't interfere because now we're talking about private plans? I mean, real quick, talk a little bit about the benefit of these small pharmacies, because see, I don't think a lot of people realize if you allow the CVS Caremark to do what they're going to do, they're going to put you guys out of business, or they're going to come in and they're going to buy out the local pharmacy, and then if there's no competition, and so then you're going to potentially have ridiculous prices. I know they would say, well, we would never do that, but come on. I mean, if it's about making money, people will do anything. They don't care when profit motive comes into play. So anyway, go ahead.
I think Tristan touched on this in that, independent pharmacies are, kind of the backbone of pharmacy. It's where all the innovation usually happens through the years. We provide services that the big box stores don't. And as small businesses, I mean, we employ people in the local community. We're a part of that. And I know just recently we've had stores close in Junction City and Marvel and Strong, and really it's created these pharmacy deserts, as we like to call it, throughout Arkansas. So, I mean, you think of the access. Pharmacists used to hang their hats on the idea that there was a healthcare professional available in just about every county. I think at one time there were maybe 2 counties in Arkansas that didn't have a pharmacy. And so many times in these smaller communities, that's the healthcare professional they go to first. Perhaps the pharmacist there can help them, or they can at least get them to where they need to go to receive the proper care. But now we've created these pharmacy deserts to where these people really have no place to go. And it's not only is the impact on healthcare in those communities, but I mean, you look at the small businesses and the tax base, and I mean, you're really creating major problems by not holding these PBMs accountable and allowing them to just control the marketplace and put these out of business. And it's not just small independent pharmacies. We've seen in recent weeks, Walgreens has made major cuts in hours and pharmacy hours. Kroger has made major cutbacks. Harp's Pharmacy has closed a few stores. Fred's Pharmacy's closed, which was, a much bigger issue with their corporation, actually closing down. But pharmacy was a big part of that. And so you see in a lot of these smaller communities, if these people, Walmart,
Yeah.
for instance, they've made a lot of cuts lately. So you can see these PBMs have gotten so large.
Yeah. I mean, if you're challenging Walmart, my goodness. I mean, if you're affecting Walmart's actions when it comes to that, that's a huge red flag.
Well, that was one thing I always looked at, is that CVS would never come into the state of Arkansas for years because they didn't want to go up against Walmart. Well, now they're big enough. They have, all these contracts in the state. They got Blue Cross, Blue Shield as a major contract, and then suddenly you started seeing CVS stores pop up
I did.
throughout the state.
I remember that.
So, I mean, it doesn't take a rocket scientist to figure out.
So how does that work? So they get Blue Cross Blue Shield under they contract, and so that means that what does that mean? Does that mean if you have a Blue Cross policy, you're going to get a cheaper price at CVS, or kind of game that out for me?
Sometimes they play that game. I think we put enough pressure back on Blue Cross to where they didn't require people to go, but still, we've seen patients bring in letters and stuff, they're actually, prompting the patient to say, hey, maybe, and then it's just the confusion they create by putting their logo on there and calling the patient and saying, if you'd go to CVS pharmacy, perhaps you could get it cheaper. Or even there's the whole mail order issue, which is a whole, other healthcare crisis in itself, because we deal with patients on a regular basis who have tried to use mail order because they claim that it's cheaper for the patient, which in actual evidence, it's not cheaper in the long run, because those costs are eventually going somewhere. They're not just giving the stuff away. And we have to deal with people not getting their medicines, or getting their medicines and it being, in a mailbox in the middle of summer at 120 degrees. And that's just not safe. It's a safety issue.
Okay. So you say sometimes they play that game. So then what else do they do? What's
And
the
then,
benefit?
and then the other thing, Blue Cross, and I think a lot of this came out during the special session, is that in essence they're basically allowing CVS Caremark to play this game and to underpay competitors and create this spread game, which we made illegal on state plans, where they can't create this spread. Pay the pharmacy one thing, then charge the state a much higher amount. We kind of held them accountable for that after we found evidence of that happening.
Right, that's taxpayer dollars.
Right.
So
And we had examples in our own store of our own employees who had Blue Cross insurance, and we would fill a prescription in our own store and then fill the prescription for the same exact product and at the CVS across town, and sometimes it would be $50, $100 more expensive. That's what they were billing, and people never know.
Wow.
So what I would encourage people to do is start paying attention. Ask for an explanation of benefits from your plan to see exactly how much is being charged to your plan, or if you're on employer-sponsored insurance, have somebody check into that to see, maybe am I getting the best deal?
That's a really good idea. Because if there's if they're all of a sudden inundated with folks figuring this out, people do not like it when they find out that they're being
And that's
scammed.
happened a lot. It's happened here in Jonesboro and across the state, to where a lot of these corporations and these industries suddenly realize, after someone tips them off, or sometimes they figure it out themselves, they're like, maybe we should go with a different insurance model.
All right, so in the future, your legislation, okay, so what would it do? Would it just mirror what we've already done with the state plans, the tax dollars? How do you do that? Because that's more of a private sector thing. There's not the taxpayer.
Well, and they hide behind these ERISA laws, that are supposed to protect, self-employed employers, saying that, somebody can't come in and usurp the authority of the contract that you made with this insurance company. And what we've got to do is just try to determine, okay, they can't hide behind this. Just because it may be legal doesn't mean it should be.
Yeah.
It's highly unethical. And one thing I mentioned, the mail order piece. I was actually at a conference a few months ago where pharmacies were getting together, pharmacists across the country, and I sat down at a table, and there was a lady there who actually was not a pharmacist. She was actually a patient advocate. She had a son that had a transplant, and just horrible things happened to her all along the way because she was forced by her insurance to use mail order. And her son, actually underwent, a lot of difficulties because of that. Didn't have the medication. The medication came in and it was, basically ruined by sitting in a mailbox. And so she has suddenly taken on the mantle and just gone around the country with this. So.
Wow. Wow.
And then also there was another group there that were oncologists. And I mean, it's not just pharmacists having this issue. PBMs, doctors and prescribers also have a role to play in this, because they're in essence telling the prescriber what they can and can't write for. And it's not based on any kind of medical evidence. It's just based on how much money that company can make off of it. So, I mean, if you think of doctors, how much time do they spend in a day with their office staff trying to get prior authorizations or trying to figure out which medication is covered, and many times having to seek alternate treatments that aren't the best for that patient, and it's all because of these middlemen.
Wow. That should be illegal. There's no reason why a doctor should be able to prescribe what's going to best treat the patient. That's ridiculous.
I mean, healthcare decisions should be made on health, on the health of the patient, and which is the most, beneficial and the most effective for that patient, not on which gets the insurance company the biggest kickback and the biggest rebate.
All right, last thing I want to ask you, maybe this is not so much PBM, but maybe this would be deregulation of what you guys can get reimbursed for and stuff. So are there any things that can be done for pharmacists? Because, in a lot of cases in these rural communities where they're still left, you guys are the primary care. So I've heard from pharmacists before about how they would love to be able to test for the flu. Is that something?
That's actually started.
Yeah,
pharmacists are able to test for many, minor things like that. That people, they don't want to go to the doctor's office and be tied up there, for a while in a waiting room, so they can actually go to their pharmacy.
Is it financially advantageous? Are you guys now getting reimbursed for that?
It is in certain communities. And
Okay.
I think you find that in smaller communities where, once again, I mentioned where the pharmacist is the most accessible healthcare, professional in that town, or maybe the only healthcare professional in that town. And in those communities, it really has caught on.
That's good. Brandon Cooper, we